As we continue our conversation about health care and the different plans between former Vice President Joe Biden and President Trump's plan, I am joined by Dr. Alita Borrud here in Rochester, retired geriatrician. And Dr. Borrud, I want to hear why you like Joe Biden's plan. From what we're hearing from critics saying socialized medicine of any kind is bad, and that's the label that they've given to Joe Biden's plan.
Well, this is not socialized medicine. This is really extending and expanding the options that we already have to people by, for instance, Joe Biden is making sure that, for instance, if you lost your employment because of COVID-19, the federal government would support your COBRA payments so you could continue your same plan. You know, if you're uninsured right now, he would open up the Affordable Care Act enrollment so that you could purchase a plan right now through the ACA. He would expand Medicaid coverage to the states, the 4 million people who currently are in Republican states that did not expand Medicaid. And he would allow people to buy into or to enroll in Medicare at age 60 instead of waiting till age 65. And finally, he would make sure that tax credits to purchase premiums on the Affordable Care Act health exchange would be lowered to just 8.5% of a family's income. So it would make purchasing an insurance plan much more affordable for everyone. So this is in no way a, quote, socialized medicine. It's making sure that everybody in the midst of this pandemic can actually get the health care they need. Which right now, I know in Minnesota, we've had numbers of people who have actually enrolled in our Minnesota Care program because they've lost their health insurance through employment. So we cannot let people go without health care in this pandemic.
Dr. Borrud, one of the things that people, this is such a difficult topic because there are so many aspects to this and thousands of pages that went into the Affordable Care Act. And so when I do interviews on these, I like to be transparent and let you know, if I ask a dumb question, I apologize because there's so much that so many of us don't know. But one of the things that people didn't like about the Affordable Care Act is that it forced people to have insurance, and if they didn't and couldn't, I shouldn't say couldn't afford it, but it really hurt them financially to have health insurance, then they had to pay a penalty. Speak to that a little bit.
Well, I think, you know, if people don't have insurance and then they get into a devastating accident, we all pay. And insurance is more affordable the more people who are involved who are in the risk pool. And so I think one of the most important aspects of making sure that everybody can actually afford coverage is to expand that risk pool. And I think that Joe Biden is doing that by essentially trying to make healthcare more affordable so more people come into the market and buy insurance.
People will vote based on a health care plan. So for that, I appreciate you helping to break this down for me and your time. Thank you, Dr. Borrud.